What's interesting to me, and I've had a chance to deal with a couple of bike companies that do the cleat fit, is that they are, and by the way, there's nothing wrong, in my opinion, with the traditional fiberglass casting, circumferential tracings, where you're doing, and they are very particular. They'll send these specialized kits to the patients that are overwhelming for the patients. So they come to clinicians like me to sort it out. Each of them has their own sort of secret sauce of how they're collecting the metrics. But to me, what's surprising is that it still hasn't been fully integrated with the 3D side. And here we are. So we're having this discussion. I think those conversations, though, will begin to start happening soon.
Well, they will, and the prime example is Lululemon with great fanfare have just brought out a running shoe for females only, and they did that based on reportedly 1 million scans that were done with a system called Volumental. I'm not sure whether you know what Volumental is, but it's
I don't. Briefly.
It's a 3D camera based system. So basically, you sit on a platform. There are 4 cameras in each corner of the platform, and they photograph the foot, and they're able to build a volumetric model of your foot. And so those machines are in every Fleet Feet franchise in the USA, all 200 whatever, and they're seeing however many people they do a day. So they've got this massive database of American feet, and Lululemon were able to tap into that database, and that's what they used to build their last for this women's only shoe. The missed opportunity, of course, is if they'd been able to build 10 lasts or 50 lasts or 100 lasts, then it would have been an absolute game changer. But still, it's a great idea, and that's the sort of information and the sort of technology that we're working with now. But personally, I'm involved right now in trying to develop a fit algorithm for retail to take them beyond where they are now, because the really interesting question here, Ben, is, and this is what a lot of people say, they say, well, listen, running shoes have evolved and they're clearly very different than they were 20 years ago, but injuries haven't changed. Well, I put it to you that it may well be that there's a lot of people who go into a retail store and they get recommended a shoe, maybe for a fit to vertical model, and they put that shoe on and think, geez, it's not very comfortable, but it's been recommended to me, so I better go and buy it. And they walk out of the store with a shoe that isn't comfortable, probably isn't right for them, and probably is going to injure them. So that interface between the client and technical retail getting the right advice is just so critical, I think, to trying to reduce the injury rate in runners. And it's something that we haven't even scratched the surface of that discussion yet. It's just sort of been floating around the ether. But the system really should be that. What I think what often happens is they go in there and people say, what are you running in at the moment? Oh, I'm running in a Kano 26. Right, here's the Kano 27. Proceed to the cash register. But what they're not understanding is that the Kano 27 could potentially be completely different in all sorts of ways to the Kano 26. And if that particular runner doesn't respond to that shoe, it won't work for them. So what really needs to happen is the runner needs to be given an offering of shoes, 3, maybe 4 shoes, with one obvious outrider. It might be a Vibram 5 Fingers, who knows? It might be an Ultra. Could be something that is just a bit out there. But it may well be that outrider is actually the one that works for them. But if you don't bring it out and you don't try it, you don't analyze it properly and look at things like the noise filter and the comfort filter and all those sorts of things, then they're going to walk out the store without the right information and potentially the right choice. So it's something that I'm really interested in trying to improve that whole situation.
You know what I think the real cool thing about you're talking about conceptually here is that for years, biomechanics has been behind pharma in getting repeatable masses of data. And so we'll have these studies, right, with 23 runners, and we group them into subsets of, 12 of this and 13. And, pharma is relying on repeated trials with 50, 60,000 people for their heart drugs. So now what you're talking about is this idea that hasn't totally reached the potential that you just mentioned, where we can have all this data and then do the last subsets to address those particular needs. It's a great resource that we've only begun to potentially scratch the surface with, as you mentioned.
Yeah, well, the other major difference is that pharma is all about dosage. So you couldn't imagine going to your doctor and him saying, well, here's some amoxicillin. How many do I take, doc? I don't know, somewhere between 1 and 10. You know, that wouldn't happen. You know, you know what you're going to take. You're going to take it twice a day with meals. That's the dosage, because that's linked completely to its efficacy. We don't do that. We don't know whether shoes, how or if they work, or an orthotic device. We don't titrate
We don't
that
have that
dosage.
sharp line. Yeah.
We don't. And this is where the stuff that Benno's doing is so important, because he's doing these very sophisticated cluster analyses and trying to work out where the clusters are. And if you can identify that, then you can work out who responds to what type of intervention, whether it be a shoe or an orthotic. And I think he's getting pretty close to that. So I expect to see some pretty good stuff coming out fairly soon.
Yeah, I hope so. I'll have to ask him about that. Hey, so let me ask you this. Give me a couple interesting things. You showed me a really cool football shoe that you designed. What else is capturing your fancy right now with either running shoe technology, or it might even be just a new mode of thought for exercise prescription? What's kind of captivated your interest? You mentioned a couple other things before, some specific functional testing.
Yeah. Well, I'm really interested in the SUV, Ben. So, you know, we're now, for the last 20 years, we've all been driving around in SUVs, and, you know, not many people drive small sedans anymore. And it occurs to me that the separation between a running shoe and a trail running shoe is probably wider than it should be. So I reckon you should be able to build an SUV shoe that is able to deal with more terrain than just running on bitumen or just running on a trail. And I think that you could integrate particular design features into a shoe that would allow that shoe to become much more of that SUV type characteristic. So I think that's an interesting concept.
I like it. I mean, so many times, right? You try to play basketball in a running shoe, and you're going to blow out your ATF. I mean, you know, there's a good chance you will anyway. Yeah. So that's cool. Let's go broader about information processing, about what you've seen historically with the international community, what's been improving. You've got some new things that you're doing in terms of the direction you're moving with the following that you have. Where do you think we are now, Simon, with information dissemination? You know, one thing I just want to point this out to you. I just interviewed this guy, and this is about as approachable of a book as I've ever read. And not to say that there aren't strengths with each biomechanics text you read, but the interesting thing about Richard Blake, Dr. Richard Blake, he's so unassuming, and yet I put some stuff up about a seminar that I'm doing tomorrow, and I'm getting notes from the French Podologic Society and Belgium and Italy. So I'll tell you what, you know, there's a hidden jewel if there ever was one in the US. And I think we got to find more of those guys that just they're just forging ahead. They're looking at the overall models that they're doing. They're critically analyzing, and they're not wedded. This is the important thing. I think they're not wedded to just one theory. I think it's important to take pieces that make sense.
Yeah. Well, I'll tell you a story about Rich Blake. So when I was fresh out of university here in Adelaide in South Australia, Rich Blake came down to Adelaide, and I think he was probably with Rick J. And who else was with him? Gosh, I can't remember. But Rich came. It might have been, actually, yeah. It might have been, or it might have been Yeah, no, I think it was, yeah. But anyway, I remember it very well. They rented this nice room in a hotel downtown, and we all went in there, and we had a weekend seminar with them. And Rich came down armed with about 5 large aluminium cases that contained a gait analysis system. And he just completely blew me out of the water. And in fact, I bought that gait analysis system from him in Adelaide, so he didn't have to cart it back to the United States. But the point here is that this is a guy who's been doing stuff at that level for 30 plus years, so he really has, as you say, it's just such a quiet, unassuming guy, but really at the pointy end of it all for such a long time. And I haven't got a copy of the book yet. I need to get online and buy it, but I'm sure it's absolutely fantastic. And
Well,
so Rich is like
he
he's
boils
on
it
your funeral
down to,
tomorrow, right?
sure, he boils it down to like Occam's razor and just some basic stuff, and having a rule of 5, let's say, or a rule of 3. So there's open-ended questions that he raises. It's unlike any other biomechanics text that I've read. Some of them are quite weighty, and you really have to like digest. It's very readable, very readable.
Yeah.
So I think this is a very nice approach for the student, but I think even the seasoned practitioner will get something out of it.
Yeah, well, I think one of the points you make about Rich that's very important is that he's not a black and white character. So I think he really understands that he's probably going to have to re-edit this book in 5 years' time because all of these things change. And if you just cling on to these theories and paradigms and you just hang on them for dear life, well, then you're not really going to move forward and you're not going to evolve. And I think Rich is one of those guys who is very much about evolving and moving forward with the current science. And that's something that is really, really important, I think.
Something very hard, by the way, as I'm learning, conversing with colleagues, it's hard to get them to break the cycle that they have in their head, their protocol. That's hardwired from podiatry school, and they do not want to break it. So it's been an interesting road trip for me as I've had my own little invention that I did, just a basic Morton's extension attached to a mitten, as it were, but then also perpetuating ideas that I've learned from other people and trying to convince people that, hey, this might be another way to approach something besides an orthotic, or here's a stretch sequence, etc. So, but clearly, I'm taught, people that are watching this are not going to probably be the people that are some of the people that could benefit the most. But it's okay, because eventually some of this will trickle down to the people that need to hear it.
It will. It is a percolation type of system. I mean, I remember so well many, many years ago, Professor Tony Redman and Professor Anne-Marie Keenan stood up at the Australian Podiatry Association conference and basically said that pronation wasn't where it was at. And honestly, I thought they were going to get lynched on the spot. I mean, the outrage was just palpable that anybody these guys are both podiatrists, that anybody could possibly say that we need to move on from that focus. And that was probably 15 or 20 years ago now. And here we are, where we've examined it critically and we think about it critically, and we don't completely discount it as being unimportant, but we've sort of embraced a broader world, and that's really where podiatry needs to be, I think. And that's just super important for us to move forward as a profession.
Do you see that we've been getting a little bit out of the vertical silos, Simon, in part because of the pandemic, with podcasts like this, and this will be dumped over to Anchor as well, so it'll be on YouTube and a podcast. But is that something that you think is improving, or do you think it's still 15 or 20% on the needle of where we need it to be?
I think it is improving, but it's improving with people kicking and screaming. I mean, just resisting it all the way. And I think there's a degree of fear about it. So one of the things that's you asked about trends here in Australia. One of the big trends here in Australia in podiatry is a very big focus on exercise, prescription exercise medicine. So people are saying, well, do we really need to prescribe an orthotic device, or is there a better way of doing this? Now, if I was going to be completely cynical, I'd say that there is a commercial value in having a practice revolved around prescribing orthotic devices. A big commercial, a big commercial value, because you can make a whole lot of money out of that. And I think that maybe some of the resistance is people saying, well, why would I want to interfere with my business model? But that's born in fear, isn't it? That's actually not thinking outside the box and saying, well, actually, there are other tools that I can use here that are still going to be great, and I'm going to be doing good for my patient, and I'm going to make a decent living out of it. I think that anybody right now who in Australia, we've got practitioners whose entire business model is orthotic therapy. Those guys they're going to sink, and they're going to burn and sink eventually, because they will not be able to sustain that business model, because it just won't be validated. So orthotic devices are always going to be around. Using them to treat injury is always going to be around. But if it's the only tool you have in the toolkit, then I think those guys are going to really struggle, because they won't be doing the correct thing by their patient, I don't believe.
And frankly, here in the US, it's been watered down to some degree, I have to say, by things like the proliferation of the Good Feet store advertisements here in the US. So you'll turn on the Today Show and you'll watch Craig Melvin and Savannah Guthrie and Hoda, and they'll be doing and then Al will do the weather. Then there'll be a little segment they'll feed in with some guy that was some second-rate actor that happens to be a shoe geek, and he's talking about shoes, not Sir Simon Bartold or Sir Richard Blake, but this guy that was a second-rate actor talking about the shoes. And then the segue, because it's already been paid for, is over to the Good Feet store. So it's a perfect little QR kind of thing, home shopping network. It's all for the betterment of your feet.
For sure. So I was in the States only 3 or 4 weeks ago, and I went to a mall in San Diego, and there's a little booth set up there with people who were heat molding orthotic devices, over the counter orthotic devices, putting people's shoe right there in the mall. And it's like, that's a bit of a shame. But
not to say that there isn't again, as we say, it's not a bash on run retail, but you get a lot of disinformation when you're trying to pretend that you have a white coat. And the line does get blurred. In fact, sometimes even the advertisements, they'll show someone with a white coat. Are they a clinician? Are they a tech? Yeah. What are they? So,
but the really good guys don't do that. The guys I know, Chris Hartner down at Naperville Running in Chicago, he's just got this incredible technical running store, and he's forgotten more about running shoes than I'm ever going to know. But he's never going to recommend a treatment for plantar heel pain or for Achilles tendinopathy. That's not what he does. So I think that we do have these people who are super knowledgeable, and the message for anybody who's listening to this is just try to find those people and develop a relationship with them, because they're the good guys, basically.
Yep.